Well, by now you should be at home because we're 30 minutes into the curfew. If you didn't stock up on booze, you're probably not able to have that relaxing glass of wine. Oh, and if you planned on leaving Gauteng for a lekker holiday in Cape Town this week, you'll have to cancel that flight. Welcome to adjusted level 4 of the lockdown, everyone. Necessary or not, well, there's lots of opinions, but we'll leave it for you to decide. Let's find out more about how government came to this decision. I'm joined by the co-chair of the COVID-19 Ministerial Advisory Committee, Professor Koleka Mlisana. Prof, thanks for your time. We appreciate it. First off, are you satisfied with the latest lockdown measures?
Good evening, Shahan, and thank you for having me, and good evening to all the viewers. The current measures that have been announced by the President, we are fine with those measures. And the reason why I'm saying that it is because just looking at the state, of the pandemic at the moment, looking at the increasing numbers that continue to increase that we're seeing each day, and we have also been seeing very concerning overwhelming of the healthcare facilities. So the question that we needed to then ask ourselves, and now that we know as well that we actually have got the Delta variant overtaking the Beta variant that we had before, and we know the characteristics of the Delta variant, that it is highly transmissible. So what then becomes important during this wave is to ensure that we actually reduce the number of new cases, we reduce infections, and secondly, we need to make sure that the hospitals can cope with the load that's coming to them. And I think the third point that's important is that it is important as a country to ensure that we're getting as many people vaccinated as possible. So if we look at those major areas, insofar as reducing the number of infections, that's why it was important then to ensure that we actually limit movement. And so by limiting movement, that's why we have got what the President said last night, that there's got to be restrictions in movement and gatherings. And secondly, ensuring and actually assuring that people stick to NPIs, because by doing that, we then reduce the levels of transmission that continue to occur. Now, when we look at the hospital, facilities, then obviously it becomes important to ensure that there are enough beds, there are enough resources, and so it's important to make sure that the departments of health, the provincial departments of health, are well prepared for that, ensuring medical supplies, the whole works. But also what becomes important, because of these high numbers of patients that we're seeing in hospitals, we therefore needed to look at how else can we reduce those numbers. What are some of the, of the things that can be done to reduce that? And that is why, as one of the things that had to be done was to actually go for the, full restrictions on alcohol sales. And the reason behind that is to ensure that, we reduce the non-COVID and non-other medical emergencies, specifically at emergencies in ICUs, in trauma units. And so all of these things put together, really, we're hoping that in these next 2 weeks, we will be able to see a difference, and then we can see how then the restrictions are managed after that.
All right, so let's talk a bit more in detail about the scientific research used to come to this latest restrictions, which the President said was scientific research. I imagine it also comes from the team of experts within the MAC. When it comes to alcohol and the ban there, you say that it was putting pressure on ICU beds. Previously, in the second wave, we got reports about how many people were in ICU because of alcohol-related admissions. How bad was it this time to justify the alcohol ban?
Okay, the other, data that actually came to our attention was a research that was done by a group of researchers in the, in UCT. An MRC, unit at UCT, where they actually wanted to see the impact of alcohol, and they were looking now specifically at unnatural deaths. Okay, so whether they are, accident related or whatever, but those deaths that are non-natural, that are non-medical. And what they actually showed us was that and they did this from March last year, and they've been monitoring this. And, what they came up with is that actually when there's a full restriction on the sale of alcohol, the reduction of unnatural deaths was actually anything between 42 deaths per day with the shorter curfew, and up to 74 deaths per day with, when we had a full lockdown. Now, what that means is that if then we go, in fact, they actually said where there's just partial bans of, on sale of alcohol, there was a questionable efficacy in reducing unnatural deaths. So from that, it means for us to gain the full impact, we would see this when there's a full restriction. And that's why we're saying we really just need this to be for the next 14 days, whilst the hospitals are struggling to cope with the number of admissions. And hopefully, when that happens, and when people go, the movement restriction is adhered to, NPIs are adhered to, we will see the peak coming down. So we really are hoping that that's what is going to happen in the next 2 weeks.
But did you see an increase in alcohol-related admissions at hospital ICU beds before you came to this decision or this recommendation?
Well, I mean, if one listens to the clinicians are always saying that, the emergency units are often busy and full of alcohol. Well, when we say alcohol-related, whether it's going to be, car accidents or people who are coming in with stab wounds or whatever. But I mean, they have been saying that they are seeing a lot of this coming in hospitals. And I mean, we know that we have got a high rate of such admissions in hospitals.
And then let's talk about gyms having to close and restaurants having to close. Is there any evidence that suggested that lots of people were contracting the virus in gyms or restaurants? How do you come to a conclusion like that?
So as the president actually announced, because of the high transmissibility of the Delta variant, so we are concerned that in situations where people are not using their masks and they are within close proximity, then it actually makes sense that then the rate of transmission is going to be increased. And so it is one other way of trying to really just cut the transmission off as quickly as possible so that we can then get back into opening up, and hopefully we see a reduction in the, in the transmissions. So because at restaurants, obviously, I mean, for instance, when you're sitting and you're having, a meal, you're not using your masks. So it was to try and look at whatever ways that are going to enhance the non-pharmaceutical interventions so as to actually block the transmission. And I mean, like, really, we're looking for anything like a circuit breaker. What is it that we can do now that's going to bring this increasing wave, make it to be shorter? Because we don't want a situation where we're having these increased infections, for prolonged periods of time.
I get the logic, but then the other question many people are raising is that taxis are still allowed to operate at full capacity. Compliance is an issue there. There's a new research from another group just today which shows that people are contracting the virus in taxis because of how close they are sitting next to each other. But there's no, regulation that says that this shouldn't happen. So when it comes to balancing things out and doing what's pretty obvious versus what's not, the question remains, why are some people restricted and others not?
No, I would agree with you there, Shahan, that, I mean, there needs to be a very clear message, insofar as taxes are concerned, because, I mean, it's the same, exposure. And so for me, I agree with you that needs to be addressed.
Yeah, so how long do you think it's going to take for us to see a decline? 14 days, is that enough, or do you reckon that the president's going to have to extend this?
Well, it's difficult to say. We're hoping that, in the next, 14 days, we will begin to see a difference. Remember that actually, now that there are these restrictions and interventions that have been announced, if we stick to those, and also if people's behavior does change, we can actually turn it around. And obviously, it's not like we're going to have to wait until the infections have come right down. But then once we see that there's a definite change in the trajectory, then it will be time to review. And I'm honestly hoping that within 14 days, we will see a significant impact and difference.
Of course, I spoke to you last week and you were suggesting that, many of the recommendations, or some, I should say, of the recommendations from the Ministerial Advisory Committee were ignored. In terms of your engagements recently and what you said should happen versus what the President announced, are they on par?
So, actually, one of the other, key areas that we're very concerned about was the preparedness, for Gauteng Hospital, for Gauteng Department of Health. So, in fact, we did have a meeting today where the department joined us as the MEC, and we were able to be taken through what the plan is, what the department is currently doing, and what they are still to do. And so, there is. For the first, is that we then we saw what the plan is, and a detailed one for each hospital where we were, they took us through as to what are the numbers currently, what stage, for stage one, they have actually analyzed the bed status, they have looked at the oxygen supplies, they have looked at areas, where there are pressure points within the hospitals, and then for the second stage, they have activated, those ABT beds. The number that they gave us was 407 of those have actually been activated. And the point that we raised, and they actually said it is activated with required human resources. And so if one looks at that, there seems to be, a response. And also they've got a third stage where they say they still have got another 30% of the remaining APT beds. And they also took us through. What we also saw is that when you're looking at bed occupancy, there are the designated COVID beds in hospital, and then there are the beds where the people the PUIs are actually hospitalized, and that is really what is pushing the occupancy to over 100%. And now that the question then arises. Is there a way of quickly identifying the status of the PUIs? And as a result, we were saying we need to look at all those. Is it and ensure that when we talk about laboratory, testing, the turnaround times must be met so that we don't end up with patients occupying beds when they could have been released, home. And the whole, plan for oxygen and other resources, and the fact that they're actually bringing in extra nurses. So really, we saw that. But I guess the question then that just becomes is, this is all there, but when is it happening? For instance, we can have money today to employ 400 or so nurses, but then the recruitment process, how long is that going to take? So really, there are still those specifics that need to be tightened because this should already be available.
Yeah.
But from your question, plans now, we have seen the plans.
And lastly, I have to ask, because, people can wear face masks, they can social distance, but is government at all being advised or pushed to prioritize vaccinating more people and to get more vaccines into this country? Because, 1.3 million, 1.4 million is not really going to do much for us.
Oh, yeah, no, definitely. No, I agree with you. It's important, and we are all aware that really until we get to levels of herd immunity, we are still going to be struggling, and we're not going to achieve much. So yes, we are actually pushing. We are advising government that it is critical to get as many doses of vaccines and exploring other vaccines as well to come into the country, and also to make sure that when we've been saying we want to get to 250, but we're still at just over 100,000. vaccinations a day. Let's push. We want to see these numbers being pushed up to 300,000 as the president has requested. So it's going to be important now that there seems to be a constant supply for the next few months. Let's see us then achieving those targets so that we can get as many people vaccinated as soon as possible.
All right. Thank you so much for speaking to us. Always a pleasure. Co-chair of the COVID-19 Ministerial Advisory Committee, Professor Koleka Mlisana.